Good afternoon. Welcome all of you for the Wildlife Disease Investigation webinar. On behalf of Life Trust India and Asian Elephant Support, I welcome all of you for this webinar. I am B.A. Daniel, representing Life Trust India. And this is the fourth webinar of this series. There are two more webinars up to go to complete the series. And the topic of this webinar is Asian elephant health in Asia. The entire webinar will be recorded, and the recorded videos will be made available to you later for your reference, and you are most welcome to share the video with others also. Today, there are two speakers, and if you have any questions, you are most welcome to just put it in the chat box. All the questions will be taken up after the completion of the presentation. Okay. Now I hand over the session to Dr. Heidi Riddle, the chair of IUC, chair of the Asian Elephant Specialist Group. She will be introducing all the presenters. To Heidi now.
Thank you, Daniel, and hello everyone, and welcome. We appreciate you logging in for this session. So our first speaker is Dr. Christopher Stremme. Dr. Christopher is a veterinarian and a former elephant handler and trainer with over 25 years of experience in elephant healthcare and management. For the last 20 years, Dr. Christopher has been involved in various captive and wild elephant welfare and conservation projects in several Asian elephant range countries. Since 2004, he's living in Sumatra, Indonesia, where he has developed and managed elephant healthcare programs with local NGOs, providing regular healthcare and management assistance for captive and wild elephants throughout Sumatra. In 2015, he joined the veterinary faculty of the Syiah Kuala University in Banda Aceh as an associate lecturer to lead the development of elephant and other wildlife veterinary training and teaching programs, as well as the development of a wildlife ambulance. Since 2016, Dr. Christopher is the program manager for the organization Community for Sumatran Nature Conservation, working on elephant conservation programs in the Way Kambas National Park. The presentation from Dr. Christopher today is on neonatal care and hand-rearing of orphan Sumatran elephants. So, Dr. Christopher, I invite you to please present.
Thank you very much. Thank you very much for the introduction, Heidi. How can I share my screen somehow here? I think the operator needs to allow me somehow to share the screen.
Daniel, can you?
Yeah, it's permitted. You are the co-host.
So, host tools, meeting profile. Where would that be? I cannot see it on my screen where to share the screen. Freigeben, co-host, host tools. Can open my screen, but it's not showing up here. I'm sorry for this. Where do I find the share screen?
Yeah, it's next to React, just below, or Vanessa.
At the bottom, there's it shows the participants, then a chat, then React, then a share. Oh, there you go.
Yeah.
Okay.
Yes.
Okay, sorry.
Yeah.
Just a second. So can you see my screen now?
Yes. Yeah, we can see the full screen now. Yeah.
Okay, cool. Thank you very much for having me. Today I want to share a little bit of the experience that I have on neonatal care and hand rearing in orphaned Sumatran elephants. So I just want to say in the beginning that just reflects my personal experiences. So this is definitely not the final and ultimate guide to this subject, just for me to have the chance to share a few of experience, and hopefully it will be useful. And I want to start with some scenes from a video taken from elephant giving birth. Just a second. So need to figure this out. Shit. Okay. Sorry for the delay. That is okay. Now it is rolling, but now I need to move it forward because we don't have to see the time to watch the entire video. Just a second, I need to adjust something here. Okay, this was an elephant that we knew in this facility, that was new in this facility. She had had a birth before, at least one, but not in this group. So, and the other group members, we did not know about their experience with giving birth. So for that reason, 3 months before giving birth, she was during night always separated in a separate enclosure. Because we did not know how the other elephants would react. We did not know how this elephant would react to make sure that there is no problem. So you can see there the calf is coming out, and in a minute you will see something very important, which I want to show in this video. No, it starts again. That's really annoying. So the calf had hit the ground, and immediately the amnion had ruptured. So it was the amnion was ruptured, which is very important to notice whether the amnion is already over the head and is over the mouth and the trunk, and if not, whether the female reacts in an appropriate way to remove that. In this situation, this female reacts very, very well, behaves very well. She is moving the calf around, which one initiates the breathing, helps to initiate the breathing, and also can help to remove the amnion if it still covers the mouth and the trunk. Because if that is still covered, and I've had cases where that happened, the calf can be suffocated by the remaining amnion on it. Yeah? So that is an important part. And fast forward for about 10 minutes, the calf starts to stand up, still very wobbly. So this is all totally normal. The way the mother has pushed the calf around, kicked the calf around, that was very, very careful from an elephant, as an elephant, very careful, very good behavior. The calf is standing up, it's falling down, it's wobbling around. This all is totally normal and no reason to worry in that scenario. Important to notice here is that the elephant is an area with natural ground, with natural substrate, where the elephant, when it starts to stand up and struggles, has good grip on the floor. So the first things in after birth that we would like, in my opinion, to check for the elephants, of course, as I said, we have to observe whether the mother accepts the calf and how the mother reacts to the calf. There are numerous of incidents where inexperienced mothers that had their first birth and had no assistance by experienced other elephants, they overreacted, they had no experience and actually reacted to the calf in an aggressive way, and even several cases where the mother killed the calf. So we need to be able to control, which in the video before you maybe saw that the mother was on a train. So in case something happened, keepers would be able to interfere and maybe pull the calf away. Then with the mother, we will inspect the birth canal for any injuries, any abnormalities. We also should check, what happens rarely, but sometimes does, if there is another calf inside. We can help or I can increase the milk letdown by using oxytocin. Usually I use 30 to 60 international units injected intramuscular, intravenously. Very important, even already antepartum, is to monitor blood calcium level and if needed, substitute the calcium. We can give some, in addition, some vitamin supplementation during the first 24 hours. And of course, we have to check for the expulsion of the afterbirth, which usually should happen within 24 hours, maximum 36 hours. I have had cases where the afterbirth was retained, but didn't on the long run not cause any significant problem. Over the next 2 weeks, slowly the parts of the afterbirth were expelled. Of course, it was smelled slightly rotten, but in these cases we monitor the blood and the white blood cell levels if there's any infection or if the mother is has any negative effect from that, which in the case that I had has never happened. Immediately postpartum for the calf, as I said, very important is to make sure that the elephant is on the ground which is not slippery. So if you have a floor in which is with concrete, which can be slippery, it's advisable to add some substrate so the calf has grip, and when it starts to stand up and is slipping, has a bit of grip on the ground. Yeah. What I said before, most important is immediately after birth to make sure that the amnion is removed from the head, from the mouth, from the trunk. And normally a calf will stand up within the first hour. Of course, it will still be wobbly and need several hours to become stable, but it will stand usually within 1 hour. If it's less than or more than 1.5 hours, there usually is a problem and you need to check the calf and interfere. Of course, we are going to disinfect the umbilicus cord with antiseptics and fly repellents for the first days until it's completely dry and falls off. And if possible, ideally measure the calf and take the body weight, and if possible, also take a blood sample for our references. In my experience, I would strongly discourage to try to help the calf to find the mother's breast, to find the nipples for nursing. Calves in the beginning sometimes look very clumsy, looking for the nipples of the mother and start to suckle on several parts of the mother. Very often initially first on the vulva, which I have seen because it's lower and easier reachable. But if you try to force the calf in that direction, it becomes more reluctant. What we can do, or what is helpful in my experience, to help to position the mother. Position the mother where she stands still, maybe puts the front leg a little bit forward so the mammalian glands are exposed. And I would strongly discourage to try to artificially nurse the calf within the first 36 hours. I have had cases where the calves only started to drink after 36 hours the first time, and they did completely fine. Any too early interference, I have cases where after 4 or 6 hours, the calf had not drinking, the people panicked and they started immediately to give a human milk formula. The calf ended up with heavy diarrhea, became dehydrated, contract gastrointestinal infection, and within another 3 or 2 days, the calf died. So I would strongly discourage that. Here is another clip where you can see the issue with the amnion. So here the calf gets out. It's also an inexperienced mother. You can see the head is covered with the amnion. The mother is checking on the calf, but does not really know to do, is excited, but is not starting to push the calf around, is not using the trunk to remove the amnion. So you can see it takes already a while.
Buka itu. Diam. Lapor cendeki. Ya. Itu dibuka dulu itu.
Still the mother is checking, but not doing anything, is not pushing the calf around, is not removing the amnion.
Dari garo nggo narik itu. Itu ketutup.
So here it needs as immediately as possible, but carefully, to remove the amnion. Of course, we have to be careful with the mother, but now you will see, as soon as the amnion is removed, immediately starts breathing. So again, don't try to nurse the calf initially too early. If there is you have the feeling there is no milk, try use oxytocin first, and try if, for example, the mother doesn't accept the calf initially, try first to gain some milk from the mother. Yeah. And if there is no milk from the mother longer than 36 hours, the calf cannot read the nipples or something, I definitely would recommend do not immediately use milk formula, but only use electrolytes in the beginning. It is totally normal, yeah. Also for calves which are nursing normally during the first week to lose some body weight. So that is no reason to panic. The only important thing is there that the calf is hydrated. Another important thing is if the calf is not born in a group together with herd mates, as soon as possible, try to socialize the calf with other elephants. Of course, not every other elephant will be automatically friendly with a calf. And also some other females might want to adopt the calf and snatch the calf. So it needs to happen under control of the mahouts, but it needs to be done as soon as possible. Good social interaction and getting to know the elephant very much is helpful to enhance normal elephant behavior from a very early age. Another thing which I found to be normal in my observations, all the elephants that I have seen that giving birth in Sumatra develop a postpartum ventral edema. And here a postpartum edema. And some elephants, especially older females, sometimes develop a ventral edema already a few days before giving birth. And this normally disappears if you provide rich, balanced diets. Within 2 weeks to 2 months, that resolves by itself. I never have given any medications to reduce that or resolve that, just provide a rich, balanced diet. I know that some people tend to use diuretics to resolve that. I don't think it does any damage, but I don't have the feeling that it is absolutely necessary. Yeah. So when would I would recommend, or when would I use or have used artificial nursing and hand rearing in elephant calves? In captive elephants, of course, if a mother rejects the calf or a mother even dies during birth or shortly after birth, there is of course no other option. We need to create an artificial nutrition for the mother, but also sometimes the mother doesn't allow to nurse the calf. In here we had a case that was the first calf of this elephant. She was a relatively slim, tall elephant, and the calf was very small. That was the first problem. The calf could not really properly reach the mother's nipples, and the mother liked the calf, protected the calf, but she didn't initially not allow the calf to nurse from its nipples. She felt not comfortable. She felt ticklish about that. So for the first 3 days, we trained the mother. We milked some milk from the mother. And for the first 3 days, we gave the milk that we milked from the mother with some electrolytes. We did not add any formula to that, only milk from the mother, which was not much, and electrolytes. And during this time, we trained the mother, restrained the mother, trained the mother to get accept the calf to touch the nipples, and we build a small platform for the calf to be able to nurse from the mother. And within the first 3 days, that happened then totally normal. And then the entire remaining development of this calf was absolutely normal and without any problems. So if a calf and a cow do not do well in the beginning together, I would not immediately remove the calf, but always recommend to try to give it time and try to adapt them to each other to enable a normal, natural nursing and normal development there. In wild elephants, of course, if a mother is killed, if an elephant gets trapped, separated from the herds at an early age, if there is no assistance, the calf will not be able to survive. So in these situations, if we interfere, of course, we also need to create some artificial nutrition. So for me, in my experience with the cases that we have handled over the past 2 decades in here, the first critical issues here is prevention of dehydration, because mostly these calves, these young calves are dehydrated. Yeah, so there is a lack of fluid intake and additional, sometimes also diarrhea. So we have to find a way to substitute the fluid and stop the diarrhea. Very often these calves have wounds, have injuries, abrasions. Of course, we need to do wound treatment, wound cleaning, and probably systemic antibiotics if there are deep infected wounds on these elephant calves. And then, of course, we need to think how we, on the medium and long term, how do we get energy into that animal, how we can get nutrients into this animal. And of course, initially we can give some glucose, we can give some amino acids intravenously. But on the long run, we need to think how to create a milk formula or some food supplements, and what and how we do that depends very much on, in my experience, on the age, on the condition of the calf and of the acceptance. So some considerations that we go first here to the hydration. So for the hydration, of course, we need to check. Mostly these calves are hydrated, at least the ones that I have had. So they have dry mucosal membranes, increased capillary refill time, reduced skin turgor, weak pulse, general weakness, anorexia, increased blood total protein, hematocrit, and creatinine. And in addition, if they have diarrhea, of course, there is the risk of metabolic acidosis. So for elephants, as to my knowledge, there are no established fluid maintenance. So I usually use the data available from horses, and in horses, the maintenance for an adult horse is about 60 milliliter per kilogram body weight per day. However, in foals, it is about 80 to 120 milliliter per kilogram per day of fluids that the animal has to get. And this is maintenance. That means if you have a dehydrated animal, it needs more than this. Yeah. So rehydration, of course, we have 3 routes. We can give injections, most ideally, of course, direct intravenous fluid substitution. Sometimes this can be challenging because very small calves, which are very weak, very dehydrated, sometimes it can be challenging to place an intravenous catheter as first help. In that case, of course, we can give some subcutaneous depots, but of course, intravenous substitution is the most ideal, and we need to ideally try to find intravenous access. Oral rehydration, for oral rehydration, we can use just products with commercially available for humans, like Pedialyte is available in many countries in different container sizes. And we can use also some from the human pharmacy. We can use some powder that are mixed, electrolyte powder, which is mixed with water. In the worst case, we only give water first, but ideally when we can, if you have no electrolytes, we can at least add some salt, 9 grams per 1 liter. Or we use coconut water, or sometimes just commercially available drinks like used for human rehydration, like Pocari Sweat, Gatorade, or something like that, can also help. if no more ideal electrolyte solutions are available. Furthermore, of course, we can do rectal rehydration with either with plain water, plain warm water, or with electrolyte solutions. The rectum has the property to reabsorb water, even if an animal has diarrhea and where there is some irritation of the rectum, still some of the fluid will resorb and will help to rehydrate this animal, which in this orphaned elephant in the wild, the most important issue in the beginning. Now, if you start to think about to create milk formula or milk replacer, we probably will look in what is available about information about elephant milk. What is actually the composition of elephant milk? The data that is available is limited, and the data in different papers varies quite a little bit. So if you read dry matters, you will find information from 50 to 24%, where it's reported either it's stable or increasing during the first month. Protein, you will report from 2.5 to 6%, with either being stable or mild increase during the first 12 months. Fat is reported between 3 to 19%, but increasing. That is consistent throughout the first 18 months. Lactose, also in lactose, we find very high variations in the different papers that are published, 2.5 to 4.5%. And we need to recognize that if we survey these papers, it seems that in the beginning, in the early lactation, in Asian elephants during the first 6 months, the content of saccharides is higher than of the fats, so above 10 milligram. And after 5-6 months, it changes. The saccharides reduce and the fats significantly increase over the next 12 to 18 months. In African elephants, it seems to last a little bit longer. Another thing is then in comparison with human milk formula, human milk replacers, elephant milk seem to have a very unique pattern of oligosaccharides and high levels and unique contents of medium chain fatty acids. So there are some very significant differences in the ingredients in the elephant milk. So if we survey these results from the different papers, obviously we see there is big variations in between the papers, and it seems that there are big variation between different elephant individuals, and even there is some proof that between two lactations from the same elephant with 2 different calves, there are difference in the milk composition. This seems to suggest that there is not one milk formula or elephant milk replacer with generally fits every elephant calf. However, there are some commercial elephant milk formulas from the company Grobber. Grobber, they actually have an elephant and an African elephant milk replacer. Or the company Salvana, they also have elephant-specific milk replacer, which surely is better than a human elephant milk replacer. The limitations with these products are mostly they are not freely available in most of the Asian range countries. The second limitation, most of these products have to be stored cool, otherwise their very short time will run rancid and we cannot use them anymore. And the third thing is even from these elephant milk replacers, which are created specifically based on data from elephants, seem not to fit automatically every elephant calf. I have talked to many colleagues from the United States. We have used these products, and they told me that even with these products, they always or very often have to make individual adjustments to different calves. So from the information that we have and from my experience, it is more or less a try and error for each individual calf with different components and different ingredients. And in my opinion, we should not rely on things that we have to import from far away. where the supply chain is not guaranteed, but better try to use products which are reliably available on the local market, where we are sure that we can get it always continuously to create our food supplement or milk replacer for our elephant calf. So when we here start to have a calf that needs a milk replacer, based on the consideration from the data, is it valuable, and based on the compositions from the commercial available elephant milk replacers that I just mentioned, it seems that elephant milk has about, in the early months, has about 1,000 to 1,200 kilocalories per liter, with about 2 to 2.5% of lactose. Human milk formula has roughly about 500 to 600 kilocalories and about 6% of lactose. So it has half the amount of energy per liter and double the amount of lactose. And it seems that lactose is one component which can trigger diarrhea if the percentage is too high. If we consider that an elephant would drink about 8 to 12% of its body weight, we need to think, if we create with a human milk replacer, we create a composition which has low lactose, then we have far too little energy. If we create with a human formula milk replacement, which has enough energy, then we will have far too much lactose, and it is likely that our elephant calf will get diarrhea, and that is a big problem. So very often, if we immediately feed high amounts of human milk formula, it will result in diarrhea, and it need to be mixed, in our experience, with other ingredients. As I mentioned already, we always start only with electrolytes. For the first 1 to up to 3 days, we only give electrolytes to stabilize the hydration of the animal, and then slowly, gradually add small amount of different solids or milk formula, milk replacer. And what we routinely start with a combination of normal human milk formula with lactose-free soya milk replacer. And then try to add other ingredients, sometimes like coconut fat, coconut oil, to slowly increase the energy, to provide enough energy that the elephant can develop. We have a problem that often the elephant drinks enough in terms of liters per day, but the liters don't have enough energy. So they don't reach the amount of 1,000 to 1,200 kilocalories. So in total, it will not be enough energy. So that is very often, it's a tricky process. Sometimes it can be very easy that an elephant accepts something and does well with it, does not develop diarrhea, but very often that is not the case, and we have to slowly experiment to find the right composition for this calf, where we slowly can add step by step energy into the milk replacer that we give the animal. An obstacle that I sometimes found to reduce the lactose content by using lactose-free soya milk formula, it seems that many elephants, at least initially, do not much like the taste of the lactose-free soya milk replacer and just reject it. And our biggest enemy, in my experience, is that the elephant develops diarrhea. So if the elephant develops heavy diarrhea, these calves, within 2-3 days, they can be so dehydrated, they contract any gastrointestinal infections, and within a few days, they die. So diarrhea, in my opinion, is the worst enemy in these very fragile calves. Any changes, of course, in the composition of the milk replacer will have to be made very slowly and in very small steps. And initially, we should feed small amounts, but very often per day. If you watch how an elephant nurses from its mother, elephants do not nurse for very long, usually not even for 30 seconds, only a few seconds, but very, very often. So I think that is what we need to be aware about, that the elephant in the beginning, we do not give too big amounts in one go, but give it very often, because too big amounts in one go in the beginning, probably the gastrointestinal tract cannot cope with, and this also can cause diarrhea. What also can cause diarrhea, of course, is a lack of hygiene and cleanliness in the management of the entire feeding equipment, the bottles, the nipples, that has to be cleaned very well and sterilized very well to prevent any bacterial contamination, which also can cause, of course, diarrhea in the elephant calf. We need to consider that the milk powder also is a very good substrate for growth of bacteria, for growth of fungus, if it's not stored very well, if it's kept open too long, if it becomes moist. Yeah? And that's then also, if you use that milk powder, it causes diarrhea. Sudden change of milk composition, I mentioned already, can cause easily diarrhea. I have seen that quite a few times. And also sudden change of feeding frequency and feeding amounts. That is important, that the team on site, which not only consists of one person, really communicates well, and there is a clear instruction what to use, how much to use, that not everybody who's coming in creates a milk formula on its own fantasy. But based on very clear instructions, everybody is involved, follows the same instructions. Bottles are used mostly for the calves, are bottles which are used also in the dairy industry, in the cattle industry for feeding calves. However, the nipples are completely different to the nipples of an elephant, and the holes are very small. And usually most elephant calves, they don't really want to suckle from this, although they suckle from the mother's breast, but the mother's breast has a very different shape. So what I have observed, not only in our cases, also in other places, including in places in Africa, what we do, we cut off the end of the nipple and increase the size of the hole. So these elephant calves that we are nursing do not really suckle, but they rather drink. They swallow the milk, and they swallow it very fast. And that, again, as I mentioned before, can lead to sudden overfeeding with amounts that the gastrointestinal tract cannot immediately cope with, at least in the beginning. So this is just an example where a bottle has been created locally, just with a piece of hose with some tape to feed the calf. Yeah. So what these calves do here is totally normal. Yeah, they dive into the feces of an adult elephant and eat the feces of an adult elephant. This is a completely normal and healthy and needed behavior, and very much supports the fast development of normal gastrointestinal flora of the elephant calves. So we should not prevent that. I have several times I've been approached by keepers and people said, oh, we are worried our elephant is eating the feces of the other elephants. We need to prevent that. No, this is normal. That is needed for the elephant and is helpful for the elephant. We need to keep in mind that an elephant, although it starts to chew on solids very early, maybe with 2-3 months, we see already the elephants pick up solid foods, they put it in the mouth, they chew on it. But at that point, they cannot yet really digest it. It needs about, in my experience, from my observation, 5 to 6 months until the elephant calves are able, of the gastrointestinal tract is able to really digest solids. And how can we verify that? Very easily by checking the feces. When the feces change from the milk stool, which is very soft like paste or like porridge, if it just changes to normal boluses, which looks the same like in adult elephants, just smaller. That is a very clear and very obvious sign that the elephant calf already can digest solid food. However, it with 6 months already can digest solid food properly. It still normally needs for a healthy development up to 1.5 years also the milk from the mother. But in calves that we rescue, where we see that already have fully formed normal feces, we now have decided not to feed any kind of milk replacer anymore, because far too often that in these calves has led to very bad diarrhea and in some cases then subsequently to the death of the elephant. So what we do, if we see the elephant has normal formed feces, we do not give milk anymore, milk formula anymore, but we try to do it without it and enhance the consumption of solid foods like young grass, very soft grass, leaves, vegetables with higher protein content, some fruits like a lot of bananas. Of course, as I said, the calves, we make sure that the calves have access to the feces of adult elephants. We take fresh dung from adult elephants if they're not together with adult elephants, and put it close to the elephants. And we provide and we create a food supplement which is cooked and fed either half liquid from a bottle or as porridge by bottle or by hand. And usually what we use are products which are easily available on the local market. That can be a variation of different things like rice, sticky rice, green and yellow soya, corn, sometimes some palm sugar, even some white sugar, coconut, palm fat or coconut oil, and adding some mineral powder and vitamin powder. And of course, always see what does the elephant like, what does the elephant accept, and by this try to add easy available high energy food source, which a kind of mimics the milk from the mother. Of course, not to the full extent. Of course, it is far not as perfect as having the normal milk from the mother, but it's much better than having a calf developing diarrhea from an inappropriate milk replacer. Yeah, as I mentioned already earlier, again, I only can repeat that elephants, as we all know, are highly social, and we should try to make all efforts also with the orphaned elephants calf to socialize them with other elephants. If we are lucky, we have a female in our elephant population, an adult female that wants to adopt the calf. However, she cannot nurse the calf, but she can adopt the calf and take care for the calf in cases where that happens. That is very, very good for the mental health and for the normal social development of the calf. But even if that is not the case, we should try to, as often as possible, socialize the orphaned calf, get it in contact with other elephants to become normal with that. Because I've seen several cases where that has not happened, and the calves become actually afraid of other elephants and feel more attached to humans, and later on difficult to socialize with other elephants. I think that is, we're also getting close to the end of the time. I think that is very briefly a little bit of my experience of what I have experienced with mainly with the cases of Sumatran elephants here in Sumatra. And I want to thank the organizations that support our wildlife veterinary work, especially our elephant veterinary work here in Sumatra, which is the International Elephant Project, Elephant Asia, and Durga Wildlife Fund. So thank you to the donors, and thank you very much for your attention. And now maybe if you have some questions, we can go to some questions. Thank you very much.
Thank you so much, Dr. Christopher, for the very interesting presentation. And there are a few questions. There's a question from Nirupama. I would like to read it out so that it will be on the record. When we have to give solid food,
Yeah, as I mentioned, I mean, if you have a calf, if you have a rescued calf with an age of a month up to 3 months, up to 4 months, we have no choice. We have no choice. We have to create a liquid milk replacer because at that age, the elephant will not be able to digest solid foods. But an elephant should always have access also from an early age to solid foods. Because as I said, they start to try to chew on it very, very early age. With 2 months, 3 months already, they pick up things, put it in the mouth. That helps to train them. And it is helpful for them to see other adult elephants to do that in my experience. And actually feeding solid food, like I just mentioned, if the elephant already is able to digest solids, then I would try to, as much as possible, reduce the milk replacer and go to solid foods. But an access to solid foods should be available from a relatively early age, but also an access to the feces from healthy adult elephants, because that helps a lot, especially if you have calves in a confined area where they can not normally have access. Then we should, in my opinion, should always try to provide some fresh feces on a regular basis.
Okay. Thank you so much. With great appreciation, there is one question. How long does it typically take for a cow to give birth after showing signs of parturition, such as discharge from the vulva?
Wow, this depends also from where the discharge is. If the allantois sac ruptures and it has discharge, then usually in 2 to 3 hours the elephant should give birth. Yeah,
Okay.
but sometimes we have very early some slime is discharged a lot earlier. Maybe they have a mucus plug usually which can be discharged up to 2 weeks before the birth. Yeah.
Okay. Another question is, in orphan calf, how we can calculate the age?
Well, there is no, I don't have the knowledge to exactly tell the age, but the first 1 to 2 weeks, the skin is still quite reddish. They have this red around the ears. They have these reddish skins. That is a very, 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 very young elephant, which is only maybe maximum three weeks of age. Another parameter is what I said. If the elephant has already formed feces, fully formed feces, normal feces, of course, small boluses, then surely it is 6 months and above.
Okay. There is one more question from Nirupama. What about the prophylaxis measure like vaccination or deworming?
Oh, very good question. So usually deworming, in here we start with the first deworming we give around 6 months of age. And vaccination in here, the only vaccination that we do with the elephants is tetanus vaccination. The earliest is between 10 to 12 months that we start tetanus vaccination.
Okay. Thank you. There are many appreciations and about the presentation. It was liked by many people. I think there is one more question. Just now they posted it. What should be the frequency of feeding artificial formula to an orphaned calf? How we can manage a calf having diarrhea?
Yeah, of course, we would like to prevent the diarrhea. Yeah, if you get a calf that has already diarrhea, I mean, if I get a calf that has already diarrhea, I would prophylactically always put it on an systemic antibiosis. Yeah, in terms of diarrhea in the calf, I probably would start with trimethoprim sulfonamide or with enrofloxacin in case of diarrhea, if I not have yet any kind of antibiogram or things like that. Yeah, if I know nothing, then and I see the diarrhea. If we see that a calf starts with diarrhea throughout the process that we are feeding a formula, then we probably need to try to adjust the composition of the formula. We have to check, is there any changes in the feeding? Is there any changing in the composition, in the frequency? Is there any problem with the hygiene? Yeah, to stop that at first. And the frequency, the frequency depends very much on the age. The younger they are, the more often. As I said, if we watch the elephants, how they nurse normally, a normal calf, that nurses usually mostly once an hour, latest every second hour. Yeah. So if we for very young calves can create a schedule where we do feeding every 2 to 3 hours at least is appropriate in my opinion. And then when the calf gets older, we can reduce the frequency and increase the amount per portion. As I said, the baseline is usually the calf takes about 8 to 12% of his body weight in liters. Yeah. But we need to make sure that this amount contains enough energy. Is not a problem if initially the energy is less. The calf will reduce a little bit weight, but over a longer period, we need to increase the energy contents to meet the energy needs of the calf.
Okay. Next question is how to tackle colic pain? Generally, or well, I mean, colic, as we know, is a symptom. It's not, colic is not a disease. I mean, we prophylactically, we of course can give pain relief if we have colic. In an adult elephant, always for me, it's 3 things. Move the elephant, so there's moving in the gut system. Give some pain medications, reduce the pain. And do rectal flushing. Flush the rectum with a lot of water. Try with flushing that the water gets deep into gastrointestinal tract, hopefully to reach the place where there is some obstacle, and flush it out. But again, colic means pain of the abdomen. Yeah, what causes the pain of the abdomen? There can be many different things. Yeah, so as long as we do not know the cause for the colic, which we often do not know, we only can start with very symptomatic things like moving the elephants, hoping the gastrointestinal moves, and give pain relief, and do rectal flushing. Yeah. There's a question from Dr. Lalit. Any commercial elephant milk formula available? Yes, I briefly mentioned that in the presentation. There are, I think, 2 or 3 two companies that I know is the United States is Grober. The name is Grober. They have an elephant and an African milk formula. And then is the company Salvana, which also produces different animal products. They have also an elephant milk replacer. But as I also mentioned, they're mostly not available in Asian range countries. They need to be stored cool, not to get rancid, which is difficult to do in many Asian countries. And from colleagues that use these in the United States or in Europe, I know that even with these specific elephant milk replacers, very often adjustments need to be made in accordance with the individual needs of an individual calf. So they do not automatically work for every calf as well. There's a question from Dr. Amir Stremme. You advise not to start any replacer before 36 hours. Means we have to wait for 36 hours. What signs we should observe during this? I would definitely observe if the calf is completely lethargic. Yeah, then I would see there's a problem. But if the calf is active, the calf is actively searching for the nipples. Yeah, and the mother is not rejecting. Of course, if the mother is rejecting the calf, then of course we have to try to interfere in that behavior. Then we have to try to restrain the cow, trying to train the female, and give the calf access. But if the mother allows the calf access, if the mother is careful with the calf, and the calf just is still searching and hasn't found the right spot, but still actively searching, and otherwise is not weak, lethargic,
then I would definitely wait up to 36 hours before I interfere in that and try to give some fluids. And again, the reason is why I have seen it happening. I've seen it happening that calves only after 36 hours the first time are successfully nursed and do fine. Yeah, that is stressful. It is stressful for us because we are panicking. We are panicking. So, oh, our calf is going to die. Our calf is going to die. And I know it's stressful. But in the opposite, I have seen cases where after 4, 5, 6 hours, the zoo management decided we have to give milk now, and they immediately gave milk replacer. The calf within hours got really bad diarrhea, got dehydrated, contracted gastrointestinal infection, and 3 or 4 days later was dead.
Okay. The next question is, do you vaccinate or tried EEHV vaccine in calf?
No, I am up to date, to my knowledge, the EHV vaccines, the availability of the EHV vaccines is very limited and still in a testing phase. There are, to my knowledge, 3 research groups that are currently developing and have started to test the effectiveness of EHV vaccines that are currently developed, but still that is still in an experimental phase. So there are, at the moment, there's still not yet available, any commercially available, any successfully tested or proven tested EHV vaccines. We are at that stage now that different vaccines at the moment are tested. It looks hopeful. It looks good, the few results that I have seen and heard, but it's still in a testing phase.
Okay. The Dr. Amir, who asked about the 36 hours, is also asking, please also let us know if we leave the bull during the process or we should separate.
Do what during what?
Or we should separate.
Separate who?
The bull. I think this is related to the question that he asked about this replacer before 36 hours.
I didn't get the point. Remove what?
That's what he has written. Maybe we can ask him to just, make another question with clarity. Maybe we can just move on to the next one. Meanwhile, Amir, maybe you can leave another question, please. There's one, again, another question. Have you come across fracture of leg on day-old elephant calf? If yes, then what are the measurements taken and protocol of treatment?
That's a very challenging task, and we have come across calves with a fractured leg. I think we had 2 cases, but there were not facilities to. There were also some other issues involved that we could not evacuate the calves to the places where we would wanted to treat them. So we have not succeeded to successfully treat these calves. And I think there are colleagues in Thailand that have probably experience with that, which are definitely more successful than the experience that I have. So I cannot give a really good answer on that, what to do. And if we have a clinic in our proximity that is experienced with domestic animal medicine, with domestic animal surgery, I would definitely consult a colleague from a surgeon from a domestic animal clinic and ask what we could do, how we could manage that the best way.
Okay. There's a question from Dr. Shusher. In infant care of motherless sunbirds and primates, we use lactose enzyme in milk replacer to make the digestion of lactose easier. Would this be an option?
Probably yes. Probably yes. I have not tried it, but probably yes. It's probably a very good input for us. Yeah, I think it's maybe a thing that we can try. I would definitely be interested to try it.
Okay. There is one more question. If the mother dies immediately after birth, how to manage the lack of cholesterol? what percentage of hand-raised calves eventually become socially integrated adults?
I don't know about percentages, and that I think depends very much how we are able to manage the calf to socialize as early as possible with other elephants. If we are lucky enough in terms of the social behavior, if we are lucky enough to have another female that adopts the calf, and even if we are more lucky, and in very individual cases that happen, if there is a lactating female who is willing to adopt a second calf, that's the best that can happen. In terms of colostrum, it seems from what we know about the placenta of the elephant, which is a bit similar from the anatomy to the ones in horses, it seems that the colostrum may not have the importance like it has in cows and in goats. Yeah, so it may seem that more antibodies passing the placenta in elephants than it do in, for example, in cows or in goats or in ruminants. So the colostrum may not have the high importance which it has in ruminants.
Okay. Yeah, I think you answered all the questions. Thank you so much for the wonderful presentation. It was really, really interesting, and we had a good number of questions also. So maybe if there is any more, I will email it to you also. Now, hand over the sessions to Heidi.